Healthcare.
Well, experts have an important warning for you today about a dangerous trend in many who suffer a heart attack. Medical reporter Liz Bonus is here with why they say many have hidden triggers or warning signs and don't even realize this, Liz.
Yeah, good evening, Kyle. Cardiologists at the Heart and Vascular Institute at St. Elizabeth Healthcare say some of those warning signs are things you don't realize that are symptoms of a heart attack, or maybe they're things that even trigger a heart attack. We ask experts today about a new report on these and meet a patient who knows exactly what we are talking about. At his home church, he had just finished playing a game of basketball.
And as I was pulling out of the parking lot, there was just a flash, like a lightning flash across my chest.
Later, Doug Newspickle told me by the time he made it home, he thought what many in a new report by WebMD say they think.
And I walked in the door and I told my wife, I said, I think I've got the flu.
But it wasn't the flu. Days later, when he saw his doctor, he was taken by ambulance into an emergency procedure to open a blocked artery called the Widowmaker.
100% is what they told me, and they put in a long stent in the main artery to the heart.
What he didn't realize is that during that time, he was actually experiencing things that were symptoms of a heart event. And this new report says there may be a few other things you may not be aware of that could also trigger a heart event. Here's what makes the list.
50% of patients who present with a heart attack present with atypical symptoms.
Those may include excessive fatigue or feeling nauseous, feeling like you're having an asthma attack or you can't breathe, or even feeling like you've got coffee jitters and you're sweating for no apparent reason. This according to heart and vascular expert Dr. D.P. Suresh.
I would say 6 out of 10 patients may not even have traditional chest pain. They may just be weak. They may just feel fatigue.
So here's what Doug Newspickle and his healthcare team want all of us most to know.
You have to be thinking that, is this coming from my heart?
If you ask that question and you say maybe yes, you likely need to see your healthcare provider right away. Luckily, Doug, our patient, had a great doctor who got him into emergency care immediately. He hopes to be playing basketball again really soon. Kyle?
And we hope he is playing basketball soon, Liz. Thank you so much. If you think you already have some of the symptoms that we just mentioned, you can find a healthcare provider at local12.com. Just click on Ask the Expert.